Hello students, this is Dr. Preeti Avari. Today I would like to show you few features of interior of cranial cavity. So you can see the cut section where we have cut open the cranial cavity. The vault of the skull is being removed. What we can see, there are three fossae in the cranial cavity. Anterior cranial fossa, middle cranial fossa, posterior cranial fossa. We will see details of each fossa. First we will start with anterior cranial fossa. Let us see bones forming anterior cranial fossa. In front you can see these plates of bone. These plates of bone are called as orbital plates of frontal bone. So in front there is frontal bone and these horizontal plates are forming floor for the frontal lobe or roof for the orbits. In between you can see one elevated sharp edge of a bone. This is the uppermost end of ethmoid, and actually you can see a plate of bone here, and this plate is called as cribriform plate on both sides. This elevated region is called as crista galli. In front of crista galli you can see a small foramen, and in front of the foramen you can see again there is vertical elevated crest or ridge present. I hope you are able to see that. This elevation is called as frontal crest. The frontal crest gives attachment to falx cerebri. Now behind these orbital plates of frontal bone, these small wings, these are the wings of sphenoid, the lesser wings of sphenoid. Now in this skull bone, the sphenoid has united with the frontal bone, so you can't see suture line in between. Otherwise, you can nicely see suture line between the frontal and the sphenoid bone. This is the free margin, posterior free margin of lesser wing of sphenoid. The medial ends of these free margins, they give rise to spines. These are called as anterior clinoidal processes. The anterior clinoidal process here are related to the middle clinoid process. So medially there are middle clinoid processes, not visible that way, but this is the location of middle clinoidal processes. Now what are the structures passing through this cribriform plate? The name is cribriform because there are small sieve-like openings in this plate. This is also part of ethmoid, and the rootlets of olfactory nerve are passing through it into the roof of the nodes. The posterior margin of the lesser wing of sphenoid, it gives attachment to, or here the sinus is present, one of the dural venous sinus. This is called as sphenoidal dural venous sinus. Now in between these two clinoidal processes, this is the part of sphenoid. This part is called as jugum sphenoidal. Behind that there is a shallow sulcus horizontally placed called as sulcus chiasmaticus. Optic chiasma is not exactly present here. It will be little bit above this sulcus chiasmaticus. The two ends of the sulcus are leading to two openings. I hope you are able to see the openings here. There is one opening I can show. This is actually a small canal opening inside the skull. This is the optic canal. Optic canal, through that optic nerve is entering in the skull along with ophthalmic artery. So this is a right-sided optic canal. Same way you have a left-sided optic canal. So this is the anterior cranial fossa. Which lobes of cerebrum will be located in this fossa? The frontal lobes, their inferior surface will be related to these plates. Now we will see features of middle cranial fossa. What is it made up of? Let us see the bones forming middle cranial fossa. In the center there is body of sphenoid. This is the body of sphenoid. On side there are wings of sphenoid. Can you see? They are placed little bit down than the lesser wing. These are the greater wings of sphenoid. And on side this is the squamous part of temporal bone. Behind, what is it? Behind this is the part of petrous part of temporal bone. Let us say this is anterosuperior surface of petrous part of temporal bone. This is the apex of the petrous part of temporal bone. So these are the four bones which are forming middle cranial fossa. Now we'll start from the center. In the center, behind this sulcus chiasmaticus, you can see a shallow depression. This is fossa for pituitary. This is sella turcica. And behind the sella turcica, the sphenoid bone is joining with the occipital bone. The basi-sphenoid joining with basi-occiput to form a plate. This vertical plate of bone is called as clivus. Now on its side there are many foramina, so we will try to understand the foramina. In front you can see foramina. These are the foramina called as foramen rotundum. These are foramen rotundum. Maxillary nerve is exiting from the skull through the foramen rotundum and entering into spinopalatine fossa or pterygopalatine fossa. So this is the foramen rotundum. Where is it present? At the junction of the body of the sphenoid and greater wing of the sphenoid. Behind that there is a lacerated foramen. You can see the margins are lacerated. This one. The lacerated foramen. This is called as foramen lacerum. Where is it located? Foramen lacerum is present where the petrous part of temporal bone is coming in close proximity with the body of sphenoid. Nothing is passing through this foramen lacerum. This foramen will be covered by cartilage in the lower part. This is as good as a very small canal. In the upper part of this foramen, at its anterior border, in the upper part of foramen lacerum, at its anterior border, two nerves are meeting together. The greater petrosal nerve meets with the deep petrosal nerve to form nerve of pterygoid canal. So this is foramen lacerum. Just lateral to foramen lacerum, you can see a oval shaped foramen. This is foramen ovale. What are the structures passing through foramen ovale? Now, to understand this, let us try to understand the greater wing of the sphenoid. This is the upper surface of that greater wing which we are looking into. Now, it will have a surface from below, which is the lower or inferior surface of greater wing. That lower surface is forming the roof of infratemporal fossa. This foramen ovale is part of this roof of infratemporal fossa. So whatever is passing through foramen ovale, either it is entering in the skull cavity or it is exiting into the infratemporal fossa. So the structures passing through foramen ovale are the mandibular division of trigeminal nerve entering in the infratemporal fossa. Accessory meningeal artery, it is entering in the skull. The lesser petrosal nerve is exiting the skull. An emissary vein which is joining the veins present inside the skull with veins outside. Now behind that, can you see posterolaterally there are very small foramens. They are very small foramen posterolaterally to the foramen ovale. These are related to the spine of sphenoid from below. These are called as foramen spinosum. So this is foramen spinosum. What are the structures passing through foramen spinosum? The middle meningeal artery is entering in the skull. The middle meningeal vein is going down and meningeal branch of mandibular nerve is entering inside to supply the dura mater. This is also called as nervus spinosus as it is related to spine of sphenoid. You can see many small impressions formed by tributaries of middle meningeal vein, and you can see many depressions and elevations. These are formed because of sulci and gyri present on the temporal lobe inferior surface. So this cranial fossa gives place for the temporal lobe to occupy. Now we'll try to see the features of this anterolateral surface of petrous part of temporal bone. In front here, or maybe on this side, on the left side, you can see a shallow depression. This depression is for the ganglion of trigeminal nerve, and this ganglion is present in a cave formed by dura mater called as Meckel's cave. Behind that you can see one elevation. This is called as arcuate eminence. The arcuate eminence is formed by superior semicircular canal. What I am trying to tell you is that within the petrous part of temporal bone, our ear is present. Somewhere here, the inner ear is present, internal ear. After that, the middle ear is present. Now we want to understand two more things here. The first thing, in this portion, nearer to the apex of petrous part of temporal bone, nearer to the apex, in this region of the petrous part of temporal bone, inside there is presence of a canal. That is canal for internal carotid artery, and this canal is called as carotid canal. I can't show you canal here because it's present within the bone. We need to cut the bone, then only we can see it. Now, in the posterior part of foramen lacerum, this canal is opening at the apex of petrous part of temporal bone. I hope you are able to see that opening near the apex of petrous part of temporal bone. On the posterior border of foramen lacerum, there is opening in the apex of petrous part of temporal bone. So internal carotid artery is entering in the skull through that opening. That is the cranial opening or the upper opening of carotid canal. Now next thing which I want to show is the optic canal and the superior orbital fissure. So I need to now can you see the anterior clinoid process? Just medial to that there is opening of optic canal. Just medial to anterior clinoid process, and lateral to this process in the middle cranial fossa, in the beginning only, anteriorly, can you see a pancreas shape opening? This is the superior orbital fissure. Now this fissure, let us say it is present at the apex of the orbit. If you see it from front, this is present at the apex of the orbit. So various structures either from orbit are entering in the skull bone, cranial cavity, or from the cranial cavity they are exiting, entering in the orbit through superior orbital fissure. So what are the structures passing through superior orbital fissure? Through the central part, oculomotor nerve, its two divisions, upper and lower division. In between them, you will see nasociliary nerve also passing, and below that the abducens nerve is passing through it. Why they are passing through this superior orbital fissure? The abducens nerve is the sixth cranial nerve, oculomotor nerve is the third cranial nerve. They want to innervate various muscles present in the orbit. These are the extraocular muscles. All the extraocular muscles will be innervated by oculomotor nerve, except for the lateral rectus, which is innervated by abducens nerve, and the superior oblique, which is innervated by trochlear nerve. So two nerves I told you, those nerves are third cranial nerve and sixth cranial nerve. So the fourth cranial nerve is also passing through this foramen, that is trochlear nerve, that will innervate superior oblique muscle. Along with that, nasociliary nerve, frontal nerve, lacrimal nerve, they are also passing through this superior orbital fissure. These are branches of ophthalmic division of trigeminal nerve. Lacrimal nerve is a sensory nerve which will carry sensations from the lacrimal gland. Nasociliary nerve it gives attachment to the ciliary ganglia. It is sensory nerve. And the frontal nerve, when it goes in front in the orbit, it gives out anterior ethmoidal nerve, posterior ethmoidal nerve, and nerves supplying to the scalp, the supratrochlear nerve and supraorbital nerve. Along with these nerves, there are various types of veins passing through this superior orbital fissure, and those veins will be superior ophthalmic vein, inferior ophthalmic vein. So these are various structures passing through the superior orbital fissure. Now I want to show you the posterior clinoid process. Now I told you this is clavus. This clavus, its upper part here on its two sides also gives out small spine-like processes. They are called as posterior clinoid processes. The anterior clinoid processes give attachment to free margin of tentorium cerebelli. The posterior clinoid process give attachment to the attached margin of tentorium cerebelli. These are the features of middle cranial fossa. Now we'll enter into the posterior cranial fossa. I want to show the specifications here now. We'll see the bones forming posterior cranial fossa. Posterior cranial fossa in the center. This whole portion is formed by occipital bone. This is condylar part of occipital bone and this is the squamous part of occipital bone. In front it is formed by petrous part of temporal bone. In the center, in front by the sphenoid, posterior part of sphenoid. So these are the petrous part of temporal bone. These are the posterior superior surfaces of petrous part of temporal bone. So I will show you features here now on the petrous part of temporal bone. First of all, this is a superior border of petrous part of temporal bone. So superior petrosal sinus will be present here. This is a fissure between the occipital and sphenoidal bone and the petrous part of temporal bone, which is leading to a foramen on both sides. There is a huge foramen in the center, foramen magnum. On its both sides, can you see irregular big foramen? This is jugular foramen. The jugular foramen is present between the occipital bone and petrous part of temporal bone. Why the name jugular foramen? Because the inferior petrosal sinus will continue as internal jugular vein over here, going down, exiting from the skull. The 9th, 10th, 11th cranial nerves, they are also passing through jugular foramen. Above the jugular foramen in the petrous part of temporal bone, can you see a small opening? This is the internal acoustic meatus in the posterior surface of petrous part of temporal bone. The 7th nerve, facial nerve, it is entering in the petrous part of temporal bone. Here it will be traveling through the facial canal related to the internal ear and middle ear. This is the intrapetrous course of facial nerve. So the 7th cranial nerve is entering in the petrous part along with the, there is a middle ear present here and internal ear also. So the 8th cranial nerve is coming out through the internal acoustic meatus. It is entering into the cranial cavity so that it can get attached to the brainstem. So 7th and 8th cranial nerves, they are passing through internal acoustic meatus along with labyrinthine branch from the basilar artery. The labyrinthine branch of basilar artery will supply to the labyrinth, internal ear. The inferior petrosal sinus is present in the suture between the sphenoid and the petrous part of temporal bone. The superior petrosal sinus is present here. Now I would like to tell you about foramen magnum, a very big foramen in the occipital bone in the center. You all know what is passing through it. The lower part of the medulla will continue as spinal cord through the foramen magnum. It will be covered by meninges, so pia mater, dura mater and arachnoid mater covering it. Then the vertebral arteries are entering inside from below through this foramen. The spinal accessory nerve is also entering inside from below. Then the anterior spinal artery, the posterior spinal arteries, they are going down along with the spinal cord through foramen magnum. There are certain structures which are attached to this clavus called as membrana tectoria, apical ligament of Dens and alar ligament of Dens. These are various structures which are coming from the first cervical vertebra and attached to the clivus. They are also passing through foramen magnum. On the sides of borders of this foramen magnum, you can say lateral border. In the upper portion, can you see canal? There is opening in the upper portion. Try to see, it is present between foramen magnum and foramen lacerum. In between them, you can see a opening. It is present actually in the lateral wall of foramen magnum, you can say like that. This is the anterior cornular canal or hypoglossal canal. So hypoglossal nerve is exiting from skull through this canal. So on both sides you can see the hypoglossal canal. The 12th cranial nerve is exiting from here. Now we'll see there are two depressions here in the squamous part of occipital bone. What are these for? These are to accommodate the cerebellar hemispheres. In between cerebellar hemispheres, there will be a vermis and there will be a posterior cerebellar notch, which will accommodate a fold of dura mater attached to this vertical elevation. This is called as internal occipital crest, and falx cerebelli will be attached here. In between them, occipital venous sinus will be located. This crest is leading to a point which is called as confluence of sinuses of Hierophili. Let us try to understand this. This is a point where various dural venous sinuses are meeting each other. From below, the occipital sinus is coming. From above, the superior sagittal sinus is coming. The superior sagittal sinus will continue as right-sided transverse sinus located into the transverse sulcus. So here you can see the transverse sulcus clearly. Can you make out there are two transverse sulci here? So the superior sagittal sinus will continue as right transverse sinus, and there is one straight sinus. The straight sinus will continue as left transverse sinus. Can you see the transverse sinus is leading to a sinus here between the petrous part and occipital bone? This sinus, which has got a sinus course, is sigmoid sinus. So transverse sinus is continuing as sigmoid sinus, and the sigmoid sinus meets with the inferior petrosal sinus, and actually the inferior petrosal sinus will continue as internal jugular vein. So I would like to show it again, the sinuses. Below there will be occipital sinus, above there will be superior sagittal sinus. This is the confluence of Hierophili. These are the sulci, transverse sulci, for accommodation of the transverse sinuses. So there will be right and left transverse sinuses here, and the transverse sinuses will continue as sigmoid sinus. So on both sides you can see there are two sigmoid sinuses. Now one more thing in the posterior cranial fossa, that is called as tentorium cerebelli, a fold of dura mater present between the cerebral hemisphere above and cerebellar hemispheres below. So covering the two cerebellar hemispheres above, there will be a U-shaped fold of dura mater called as tentorium cerebelli. The margin of this tentorium cerebelli, called as attached margin, is attached to the lips of this transverse sinus or transverse sulcus. So this transverse sulcus, it has got upper lip and lower lip. So these lips give attachment to the attached margin of tentorium cerebelli, and the same will extend on the superior border of petrous part of temporal bone. So that is a tent-like fold of dura mater which is covering the cerebellum, and on that tent will lie the occipital lobes of cerebrum. So we have covered most of the cranial fossa. Thank you.